Happy Monday, and thanks again for all you do for Gleaners. As promised, we're going to talk about Henry's Groceries this week. It's our first really significant pilot with Henry Ford Health System to try to prove that healthcare can in fact give us additional reach, resources, and do the research we need to prove that solving for hunger solves a lot of other problems as well. I love this logo. It is so friendly and warm. I just want to say there's so much work that goes into these pilots so that we can make it as friendly and as appropriate as we can for the people we're serving. And they did a great job. Henry Ford Health System is an awesome partner, and I think we started off really well. Quickly, the program provides patients that screen positive for food insecurity healthy, nutritious food every 2 weeks. We made sure after each distribution that it's enough food, and if it's not enough food, we will do more. 80% of the people, though, thus far, it's been enough food. But 20% actually needed more food, and so it's really important that we learn, is the food we're distributing the right amount, and is it the food that people want and need, which I'll get to a little bit later. So we started the program on November 4th, so it's only a couple months old, and we want to grow it to 300 patients, so a fairly small pilot. But that's part of the strategy. You want to learn small, and then once you learn, take it to scale. The program is going to run for 6 months, and it's a rolling 6 months, so we're only at about 189 enrollment now, so it might take a few more months before we even get to full enrollment, and then the last person enrolled, it'll go 6 months from that. It's diet specific for patient populations that have multiple chronic health conditions, so they might have diabetes and high blood pressure, things that are causing them to need more medical care than most people need. And it's also delivered to people's homes, a very unique part of this, so we can increase participation by not making people come to the clinic or to a pantry. We actually deliver it to their homes. Thus far, we've screened 879 patients, and 190, or 22% of them, that's about 1 in 5, have been food insecure. Of those, 160 were offered enrollment. There's some reasons why people can't use this program. I'm not going to go into that right now, but if they can use it, 158 of 160 said, yes, this is a program that I want and need. That's really important as we start these pilots to make sure it's something that actually works for people. Patients are really grateful. If you get a chance to go on one of the Henry's Groceries runs, definitely do it. You'll see how happy people are to get the food. They're using the food. They tell us that it's been really helpful to them as they've managed their health care, and that takes away a big trade-off that people often have to make between food, or paying for food, and paying for health care. So this is good research. It's starting out very positively. People are very happy to get the assistance, and the team is doing a great job making sure we're successful. That's all for now. Thanks for listening, and let's keep moving onward and upward.